So there are multiple ways which a heart rhythm disorder can manifest itself. So there are some genetic syndromes which happen with birth. So there may be some extra wires which shouldn't have been there, which are developed, and now these extra wires short circuit with the normal wires to cause fast heart beating, to cause the heartbeat to go beyond 200 or 250. There are some genetic syndromes where the ECG gets disturbed and we can diagnose them by taking an ECG, such as a Brugada syndrome, which some of you may have heard of, or a long QT syndrome. Now this causes children to faint out. So when these disorders happen in children, they faint out. And many of the children are actually treated as epilepsy, and only when they come to a cardiologist likes and the ECG is done that we diagnose that this is a long QT or a Brugada, and the fainting is because of the heart, not because of the brain. So some fainting episodes may be related to heart rhythm disorders. Then there could be disorders where a patient may just faint. An elderly individual, it's very common to have them faint out, and we find that they may need a pacemaker. Then there are some certain heart rhythm disorders which can lead to sudden death, sudden collapse. And these are very, very dangerous, because if we do not diagnose them before such an episode happens, that means that person, if he suffers from this episode at home, he's going to die without any warning, without anybody knowing what happened, and may just collapse in front of eyes of the relatives sitting there. So that means that this heart rhythm disorders can be very innocuous, where there may be some few missed beats, to prolonged palpitations where there may be palpitations going, heart rate going to 200, 300, and the patient knows this palpitation, to a person fainting out, to someone who dies suddenly. So a large horizon which encompasses this heart rhythm disorders. That makes it very, very important that we must understand and must know about what heart rhythm disorders are.